Next, understanding HIPAA and HITECH. The Health Insurance Portability and Accountability Act, also referred to as HIPAA, and the Health Information Technology for Economic and Clinical Health, also referred to as HITECH Act, are foundational regulations that govern the privacy and security of health information in the United States. Understanding these regulations is crucial for health information technology, also referred to as health IT professionals, as they dictate how health information can be managed, shared, and protected in healthcare environments. This module provides a detailed explanation of HIPAA and HITECH, outlining their key provisions, requirements, and implications for health IT. Firstly, overview of HIPAA. It was enacted in 1996. HIPAA was designed to improve the efficiency of the healthcare system and protect patients' privacy. HIPAA has several components with two primary roles focusing on privacy and security. Firstly, HIPAA privacy rule. This rule establishes national standards for the protection of individuals' medical records and personal health information, also referred to as PHI. Key provisions of the privacy rule include protecting health information, permitted uses and disclosures, and patient rights. Firstly, protected health information. PHI encompasses any information that can identify an individual and relates to their health status, health provision, or payment for healthcare services. Next, permitted uses and disclosures. The privacy rule outlines the permissible circumstances under which PHI can be assessed, used, or disclosed, such as for treatment, payment, and healthcare operations. It also allows for patient consent in certain situations. Next, patient rights. HIPAA grants patients several rights regarding their health information, including the right to access their medical records, request amendments, and receive an accounting of disclosures made by covered entities. Next, HIPAA security rule. This rule sets standards for protecting electronic PHI, also referred to as EPHI, through administrative, physical, and technical safeguards. Key provisions include firstly, administrative safeguards. This includes policies and procedures to manage security measures and risk assessment processes. This also includes training workforce members and assigning security responsibilities. Next, physical safeguards. These include measures to protect physical locations and equipment that stores EPHI, such as controlling physical access to facilities and securing devices. Next, technical safeguards. This includes technology related security measures that protect EPHI, including access controls, authentication, encryption, and audit controls to monitor access to sensitive information. Next, overview of HITECH Act. The HITECH Act, enacted in 2009 as a part of the American Recovery and Reinvestment Act, aims to promote the adoption of health information technology and strengthens the privacy and security protections under HIPAA. Key provisions of HITECH Act include incentives for EHR adoption, breach notification requirements, strengthening privacy and security protections, and improving patient rights. Firstly, incentives for EHR adoption. HITECH provides financial incentives for eligible healthcare providers to adapt and demonstrate meaningful use of certified electronic health records, also referred to as EHR technology, enhancing the efficiency and effectiveness of healthcare delivery. Next, breach notification requirements. HITECH established stricter requirements for breach notification of unsecured PHI. Covered entities must notify affected individuals, the Secretary of Health and Human Services, also referred to as HHS, and in some cases, the media if the breach affects 500 or more individuals. Next, strengthening privacy and security protections. HITECH enhances HIPAA regulations by increasing the penalties for violations and mandating that business associates also comply with HIPAA privacy and security rules. This includes implementing safeguards for data protection and ensuring compliance with breach notification requirements. Next, improving patient rights. The HITECH Act expands on patients' rights regarding their health information, including the right to access and obtain copies of their EHRs more easily. This provision reinforces the principle that patients should have ownership and control over their health data. Next, compliance requirements. Health IT professionals must ensure compliance with both HIPAA and HITECH by adopting the following practices. These include training and education, conducting risk assessments, documentation and policies, and incident response plans. Firstly, training and education. Ongoing training for staff on HIPAA and HITECH regulations is essential for ensuring compliance and awareness of data privacy and security measures. Employees should be knowledgeable about the standards and requirements applicable to their roles. Next, conducting risk assessments. Regular risk assessments to identify vulnerabilities in organizational practices regarding PHI and EPHI are necessary for compliance. Organizations should develop and implement appropriate risk management strategies based on assessment findings. Next, documentation and policies. Developing clear policies and procedures that reflect compliance with HIPAA and HITECH standards is essential. Documentation should outline how patient information is handled, disclosed, and protected. Next, incident response plans. Establishing an effective incident response plan ensures that organizations can respond promptly to data breaches or security incidents while meeting notification obligations as required by regulations. Next, challenges in HIPAA and high-tech compliance is include evolving technology, interoperability, complexity of compliance, and insider threats. Firstly, evolving technology. Rapid technological advancements in health IT can present challenges for maintaining compliance. Organizations must continuously update their policies and training programs to reflect new technologies and associated risks. Next, interoperability. Achieving interoperability while ensuring compliance with privacy regulations can be complex as healthcare organizations strive to share patient information across different systems securely. Balancing the need for interoperable systems while adhering to stringent privacy regulations is an ongoing challenge. Next, complexity of compliance. For many healthcare providers, understanding and implementing the myriad of regulations and requirements outlined by HIPAA and HITECH can be complex. Smaller organizations or those with limited staff may find it particularly challenging to maintain compliance without dedicated resources. Next, insider threats. While regulations like HIPAA focus on external threats, insider threats, whether intentional or unintentional, pose significant risks to patient data security. Ensuring that all employees understand their responsibilities and maintain high standards for safeguarding patient information is critical. Next, best practices for HIPAA and high-tech compliance. To navigate the complexities of HIPAA and high-tech compliance successfully, health IT professionals and organizations can adapt several best practices. These include developing a compliance program, conducting regular training sessions, implementing strong access controls, utilizing security measures, maintaining documentation, and engaging legal and compliance experts. Firstly, developing a compliance program, establishing a comprehensive compliance program that includes regular training, risk management, and audits can help organizations remain accountable and proactive in meeting regulatory requirements. This program should include roles and responsibilities for compliance and a clear process for monitoring adherence. Next, conducting regular training sessions. Ongoing training should be conducted to keep employees informed about data privacy, security safeguards, and the implications of HIPAA and high-tech. This can include workshops, e learning courses, or regular updates on regulatory changes. Next, implementing strong access controls. Establishing access controls that restrict sensitive patient information to only those personnel who need it for their roles. Using role based access controls, also referred to as RBAC, enhances security and minimizes the risk of unauthorized access to personal health information. Next, utilizing security measures. Implementing robust security measures such as data encryption, secure data transmission, and audit logs can protect sensitive health information from breaches and unauthorized access. Regular scrutiny assessments should also be conducted to identify vulnerabilities. Next, maintaining documentation. Keeping thorough records of all policies, procedures, and training sessions is essential. Documentation can serve as a proof of compliance during audits and can also be valuable in addressing any incident involving patient data. Next, engaging legal and compliance experts. Organizations should consider involving legal and compliance experts who can provide guidance on HIPAA and HITECH regulations, helping to navigate complexities and stay up to date with changing requirements. Next, conclusion. A comprehensive understanding of HIPAA and HITECH is essential for health IT professionals. These regulations set the foundation for protecting patient information and ensuring privacy in the rapidly evolving landscape of healthcare technology. By understanding the key provisions, compliance requirements, and best practices for maintaining adherence, health organizations can build a culture of accountability and security. As healthcare continues to integrate technology into its operations, ongoing education and adaptation to new technologies and regulations will be crucial for health IT professionals committed to safeguarding patient data and enhancing the quality of care provided. Mastery of HIPAA and high-tech regulations not only mitigates risks and legal repercussions, but also fosters trust among patients and stakeholders, ultimately promoting a more secure and effective healthcare environment. Thank you.